everyone. I am myself Dr. Rajesh Gubba. I'm the general medicine educator for your NEET SS and as well as the INICT SS. So I'm myself the cardiologist. So now in this particular short video, I'll be discussing about how you should approach for the NEET SS and as well as the INICT SS exam. So let me just give you a brief introduction. What exactly is the difference between the INICT SS and as well as the NEET SS? So basically the super specialty exams are conducted by the two organizations or two exams. One is INICT and the other one is NEET SS. INICT, it is the exam which is conducted by AIIMS, JIPMER, and as well as the PGH Chandigarh. So these three colleges are the one which will be conducting the INICT. Whereas NEET SS, it's a national level exam for other medical colleges and as well as deemed universities. So the exam pattern, marking schemes, timelines, they are completely different for these two exams. So this is like, you need to be aware of that there are two exams. Now you take the exam pattern. So if you take the exam pattern, like for NEET SS, you have totally around 150 questions, and that will be around 2.5 hours. And what type of questions it will be? Completely multiple choice questions based. That the curriculum or the syllabus will be your MD or the DNB level curriculum. And most of the times, the questions that will be asked for you will be clinical based questions, or they will be asking you a real life clinical case scenarios, right? And case based questions, or even the image based questions. Okay, so these will be the questions that will be asked in the exam. Single liners, right? Uncommon. Most of them, they are clinical based, or your real life case based scenarios, as well as the image based questions. So these will be the type of the questions. Whereas you take the INICT SS, the pattern may differ based on the institute, but high weightage is given by the AIIMS New Delhi. Now, you should know the subject weightage, because in the general medicine, we have cardiology, endocrinology, then gastro, nephro, neuro, and the remaining topics. So major weightage is given for cardiology, right? 20% of your paper will be from the cardiology, then 20% will be the endocrinology, then gastro, nephro, and as well as neurology will be 15%. And remaining topics, like you have hematology and as well as the oncology. So this is the subject weightage, like for the individual subjects. Okay. Now, after having said about the weightage and as well as the pattern of the examination and as well as the distribution of the marks in the individual subject, let me just give you a quick idea or the strategy that you need to follow for preparing. Okay. So first and foremost, depending upon the weightage of the topics, you need to divide the time schedule. Like as we have said, like for the cardiology, like you have high scoring, 20%. So you try to give more time for the cardiology, right? And then subsequently, you divide it for your nephrology, then neurology, gastroenterology, endocrinology, then rheumat and as well as hemat and as well as oncology. So whichever are high scoring, you divide the time, right? You divide your time, whatever you are allotting for your preparation, into like the major weightage for your cardiology and the remaining for the other topics. And whenever you are preparing, what is the books that you need to follow? So you need to use the standard books. The standard books, majority of the time, the coverage will be from Harrison. So if you take our 4.0 version, the entire content is from the Harrison, and also it includes for cardiology, we have also included the content from the Braunwald. That is the reason why if you take like 4.0 version, you are having almost 500 plus hours of the content is there, where we have discussed in detail about each and every topic. And we have discussed the clinical case and as well as real based scenarios as well. Okay. And now you take the clinical based learning. You need to focus on the case studies. you need to solve the real life clinical problems. And very, very important part of your preparation, that is, you need to practice the previous year questions that will help you in getting an idea how the questions will be asked. But I don't say the same questions will be asked and the same options will be asked, but the topics will be more or less the same, but the options will be different and the framing of the question will be different. So you will get an idea of what to prepare and how to prepare by practicing the previous year question papers. That is very, very important part of your preparation. And next important is revision. Revision you need to do by using either flashcards, right? Or you need to just summarize the topic by the end of the entire lengthy video. So you need to write your own notes, the summary of the entire video that you have seen. So these flashcards and as well as summaries for the quick revision, that is very, very important thing in the revision technique. Okay, like for example, there are certain guidelines, example guidelines for ACLS, guidelines for ARDS. You will have these flowcharts. So you need to use that particular flowcharts for the quick revision. So revision is another very, very important part of your preparation, because you read for one time or two time, that may not fix in your brain. So definitely the revision plays a key role in your preparation. Okay, then followed by that, the mock test. So try to give as many number of possible mock tests. Okay, because these full-length mock exams and as well as time-bound problems, this will give you a simulation what exactly will be the real exam. So you need to be ensured with as many number of possible mock exams or the mock test. That will give you an idea of how is your preparation. That will give you an idea what type of questions can appear in the final exam. So giving mock exams or mock test is a very, very important part of your preparation. All right. And the next important is, let me just give you the important topics, right? Until now, I have just given you the weightage: cardiology, endocrinology, neurology, nephrology, gastroenterology. I have just given you only the weightage. Now, let me just try to tell you what are the important topics in that particular chapters which you should not miss before going to your exam. So if you take the important topics in case of cardiology, without reading these topics, going to the exam is like equivalent to a big harm. Myocardial infarction, heart failure, arrhythmias, valvular heart disease. Definitely you need to read these just before going to the exam and even revise these topics before going to the exam. And you need to know all the guidelines, the updated guidelines which have been introduced in all these particular topics like MI, heart failure, arrhythmia, and as well as valvular heart diseases. And if you take the important topics in the nephrology, glomerular diseases, that is your nephrotic syndrome and nephritic syndrome, renal failure, acute and as well as chronic kidney injuries, then renal replacement therapy in the form of dialysis and as well as kidney transplantation. These are very, very important from the nephrology point of view, right? And next important is endocrinology. So in endocrinology, the important topics that you should definitely revise is diabetes, thyroid, adrenal gland pathologies, and bone metabolism. Okay, so in adrenal gland pathologies, all like your Cushing syndrome, Conn syndrome, Addison's, pheochromocytoma, all these you need to completely revise. And next, bone metabolism, your parathyroid, hyper and hypoparathyroidism, vitamin D metabolism, that is your osteomalacia and as well as rickets. So everything about the bone metabolism is very important. So these are the important topics in the endocrinology. And followed by that, next is the gastroenterology. So if you take gastroenterology, liver diseases are very, very important. That is cirrhosis of liver and its complications, right? In the complications, like you need to be completely thorough about ascites, portal hypertension, spontaneous bacterial peritonitis, hepatic encephalopathy, hepatorenal syndrome, and hepatopulmonary syndrome. Then alcoholic liver disease is another very, very important. And if you take per se gastrointestinal, inflammatory bowel diseases, esophageal disorders, pancreatitis, these are very important topics in the gastroenterology. Now, followed by that, neurology. Very important topic in the neurology is the stroke and as well as its management. There are many new guidelines which have come up for the stroke management. You need to be completely thorough about the new guidelines. Epilepsy is another very important topic. CNS infections like your meningitis and as well as intracranial space occupying lesions caused by the infections, and neurodegenerative diseases. These are the important topics in the neurology, out of which stroke management is very, very important because many new guidelines have come up. And regarding the infections like HIV, tuberculosis, and some tropical infections are very important. Then followed by hematology. In the hematology, leukemias are very, very important. That is acute and as well as chronic lymphocytic and as well as myeloid leukemias, and then coagulopathies. And you should also have a quick discussion or quick idea about the topic of anemia as well. But leukemias, they are very, very important. So these are the important topics in the individual chapters. Now, coming to the time management. So whenever you are preparing, you need to break down your daily schedule, right? See, three things what you need to do your preparation. First is reading the main theory aspect, understanding the concept. Second, giving the mock exams. Third, revision. These three are very, very important part of your preparation. Okay. Now, whenever you're preparing, like I have given you the weightage, 70% of the time you try to give for the high yield subjects, right? Or the high yield chapters, and remaining 30% for less weighted subjects, because it is the high yield subjects which is like more scoring. And in that, you need to read main theory, mock exams, and as well as the revision of that particular high yield subject. So that is how you need to break down your entire time schedule. And whenever you're preparing, the common thing which builds up is stress. So how to handle the stress and being motivated, because that is a very important part of the preparation. Along with understanding the concepts, giving mock exams, and as well as doing the revision, the very important part of preparation is handling the stress, because multiple stressors, like you need to attend to your duties, you need to see your patients, ward rounds, then as well as your family life, and as well as your preparation. So multiple things will be going on. So handling the stress and being motivated is very, very important part of preparation. So you need to develop a routine. Let me tell you, this looks very simple, but your exercise will release a lot of endorphins that keeps you completely a sense of happiness, well-being, and being motivated. Next is meditation, very, very important. And you need to practice some relaxation techniques. So exercise, meditation, and as well as relaxation techniques, you just keep these as a routine, because these are very, very important part of your stress management. Okay. And whenever you are sitting for the long hours, try to take short breaks that will try to maintain the focus during your long study hours. Okay. And self-motivated, right? Let me tell you, your intrinsic motivation, the internal motivation should be very strong enough then compared to that of your external motivation. The external motivation will stay only for 1 or 2 days, but the internal motivation or intrinsic motivation is the one which will keep you lifelong. So that will give you a push to continue your preparation. So be self-motivated throughout your preparation and try to maintain the balance. Okay. Next, then followed by that, what are the common mistakes that you should avoid during your preparation and as well as during your exams? The common mistakes is that don't completely rely your preparation on the MCQ books only. That is not correct. So first you should understand the concept. Then you practice the multiple choice questions that makes a sense of your preparation. Right? Because if you completely rely on MCQs, you will not be understanding the concepts. And don't skip the previous year papers. So please make sure that you practice the previous year questions. And at the same time, don't ignore the clinical case practice and don't ignore the time management. Time management is very, very important. Each and every minute counts when you are preparing for your SS exam, because there is a lot of competition in the external world, right? So these are the things which you need to take care when you are preparing. Okay. And lastly, if you see, success in both INICET SS exam and NEET SS requires a strategic study. You need to practice the previous year questions and you need to maintain the balance of your life. So you need to stay completely focused. Trust your preparation. Be self-confident that I can do it. If you're not confident about yourself, then the preparation does not go smooth. And don't overburden yourself in the last weeks before the exam. So if you overburden last week before the exam, the result will not be there. So you have to start the preparation in the early hours, maintain a proper plan and strategy, Be completely focused. Try to maintain your balance in the life. That is your ward duties, night duties, your preparation, and as well as the family life. And once you are trying to do all these properly, then you can score in a very decent manner. And in PrepLadder 4.0, we have given all these so that you will be able to crack the exam comfortably. So, with this, I just want to conclude by saying you all the best for your exams. Thank you very much.